Good afternoon, ladies and gentlemen. This is Tracy Armstrong with North Pittsburgh Greeting Company, the area's premier welcome wagon service, welcoming all the new homeowners and the new business owners to the ever-growing North Pittsburgh area. Today, we are speaking with Dr. Dan Turo of Turo Family Chiropractic, located in the North Hills part of the Pittsburgh area. Him and his wonderful wife run a phenomenal practice, and they're just wonderful. And Dan's going to tell us about some interesting stories. Dan, you mentioned to me that you had an interesting patient come in to see you recently. Can you share a little bit more about that?
Yeah, so I really wanted to make sure that this was fresh in my mind. So I wanted to share because it's just happened last night, and it's happening more and more frequently. We have these individuals come in, and it's always the last resort, right? So they've been to neurologists, they've been to their cardiologist, and they just have these series of symptoms that have come up. This young woman, was having shaking in her right arm and her entire right side. And these episodes would come on over the last couple months to the point where she couldn't even walk. She was having some neck pain, some stiffness, but they were to the point of thinking it was possible epilepsy, some sort of seizure disorder, Parkinson's, and so she went to the neurologist, and she was at several neurologists and just couldn't get a straight answer as to what they thought this was, to the point where they were actually chalking it up to like a psychosomatic, which again, it was psychological, and because they had no clue as to what it could be. And again, this woman and her husband are both pharmacists, and so they're very intelligent people, and so they're jumping online and trying to figure out, like, well, what could this be, because they weren't getting straight answers from the specialists, and they asked, and they had to push for certain tests to be done, and at the end of the day, they finally were pushing to ask the neurologist, well, could this be related to the neck? And of course, the specialist's like, no, there's no possible way. And it's just so sad, because the possibilities, when you're talking about an intricate system of the body like the nervous system, the possibility of how a condition could present are really endless. They're limitless. So but again, unfortunately, health professionals are trained, especially in medicine. If you don't meet a certain criteria, if you don't check a certain number of boxes so that they can put you in a specific diagnosis, well, we don't know what's going on, so it must be this. And it's just, they give you a cop-out diagnosis, pawning it off as psychosomatic, as psychological. And I'm not saying that can't be the case in certain cases, but they don't dive deep enough to rule everything out. And so that was the frustration of this woman, young woman coming in last night, because she just wanted answers. And again, she was really looking at our office as the possibility just to rule out, could there be something going on, in the neck or the spine that was affecting the nervous system that could be causing this random shaking that she was experiencing over the last 2 months.
So I don't immediately think chiropractor for something like this. Do you see a lot of patients that have this much trouble finding answers? Because that can be really frustrating to somebody.
Yeah, and unfortunately, Tracy, we're seeing it more and more often where, again, you don't fit that specific diagnostic check mark. You don't fit all the boxes. So, you have a couple, symptoms from one, disease or condition, and a couple symptoms from another, but you don't, fit the parameters of a specific diagnosis, in the big DSM, manual. And so what happens is then, you go down this rabbit hole of, you're going to go to one specialist, and if they don't have the answers, then you're going to go to the next one, and then the next one, and then the next one. You're just going to keep hopping specialist to specialist, with these weak diagnoses and analysis of what is actually going on. So, I always say, if we took a step back and went to the master control system of the body, your nervous system, okay? This brain, spinal cord, and all the intricate nerves that connect to every cell, tissue, and organ in the body. If you go to the foundation of that system and really, start to understand and analyze that, and if you can figure out how to properly harmonize it, how to properly coordinate it, which is exactly what chiropractors do. And there are ways of analyzing this nerve system function that is completely non-invasive. If someone were to start there, we wouldn't just save that person tens of thousands of dollars. We would save our healthcare system tens of billions, hundreds of billions of dollars, because we're starting from least invasive and then you can go
Hmm.
down further from there. Again, the challenge becomes, there's no money in that, right?
Yeah.
So, and again, I'm not saying that I'm sitting here with all the answers. That's not what
No,
I'm saying. But
absolutely not.
if you have technology that can at least look very, quickly and assess someone, do they have dysfunction in the nervous system that could be, correlating to their health challenge? And do you have a method of intervening to help that nervous system function more appropriately, adapt more appropriately? Let's go down that route and let's see if that could be, the solution at the root cause. And I always tell people, start there, because it's so much easier to go least invasive and add more. Once you go to the more invasive stuff and you start at the top with these specialists, again, not only are you spending tons of money, and whether or not you're paying for it, you might have a good insurance plan, but again, it's still a burden on the system. So if you have a good
Yeah.
insurance plan, someone's paying for it, someone's footing the bill. So you have these bills that are just increasing the demand on our entire healthcare system. Why wouldn't we start more from a least invasive approach? And I think some of that comes from, there are a lot of health professionals, including in my profession, that might not have the best analysis tools.
And what are you doing as a chiropractor that's different from other health professionals?
Yeah, so that is the key. As I just said, do you have the proper tools? So if I, as a chiropractor, am sitting here saying that I can help your nervous system function more efficiently, then I better be able to have a way of analyzing it, rather than, you just telling me, oh, you feel better or you don't feel better. Certainly that's one way of gauging someone is improving, but it goes so much deeper than that. So, one thing that we really look at on a day-to-day basis with the patients who come into our office, something called an infrared thermal image.
Hmm.
It's a high profile temperature picture of the skin over the spine. Well, temperature, like everything else in your body, is controlled and coordinated by your nervous system. So if you're seeing a lot of temperature fluctuations, deviations outside of normal, then it tells us that there's some sort of dysfunction or some sort of stress in the nervous system. Now, that doesn't mean that's where the problem is. Now we have to go look, from a chiropractic perspective, is where is that stress coming from? Where could that stress be coming from? And so then we layer the next step of, is it coming from the spine? Now we have to look at, we have to look at structural x-rays and functional or dynamic x-rays. That's actually how this individual was referred to us. She was looking up something called dynamic motion x-ray,
Okay.
because again, she was wondering, could what she has going on with the shaking be coming from her neck? And so she finally found, a practice that ended up referring her to us, because we have that dynamic motion x-ray technology where we're looking at how is the spine moving, and more importantly, how is it not moving? Because if the spine is locked up, if it's not moving appropriately, motion is life. So if you don't have the proper motion in the spine, your nervous system is going to be stressed out, and then too much stress decreases your body's ability to adapt. And that could present, again, in countless different ways. In this woman's case, it was presenting as this massive shaking, and these episodes of shaking in the right-hand side of her body. But that same stress could, express itself as a headache. It could
Hmm.
express itself as an ear infection in a young kid. It could express itself as neck pain, tingling, and numbness. It can express itself as digestive challenges. I can't tell you the number of people that we've helped with digestive challenges, because again, it's all coming from the stress on their nervous system where their spine is locked up. We correct the cause of that, and we get their spine moving better. Now their nervous system is adapting better, and now their body is functioning at a much higher, healthier level.
Fantastic. Why is your office a good fit for those difficult cases? Well,
Well,
because you're fantastic.
well, yeah, yeah, because everyone loves us now.
That's because you're Dan Turo.
It really does come down to, I always say, anyone who comes into my office, I'm going to help you no matter what. Either we're going to realize that, what you have going on with your health challenge, we can't help with that, and I'm going to let you know that, and I'm
Sure.
going to do my best to help you find someone to resolve, to get to the underlying cause of your challenge, or we have the tools and technology to be able to determine, can we help or not help. So that's what I tell everyone who comes into my office, is that I'm going to let you know whether or not I can help you, and do that very, very early on in your care to make
Mhm.
sure that you're getting to the underlying solution. But we have the tools and technology available. Again, it's not the you know very simple, come in and I'm just going to use my hands, or just lay down on the table, and we're gonna pop, twist, and crack you, which again, unfortunately, is the myth and misconception, but the public viewpoint of what chiropractic is. I think that's starting to change, but the tools and technology are there so that we have that 21st century chiropractic, we have that 21st century analysis, so that it helps me understand how your body is adapting and responding. But you, as the patient, as the client, can also see the changes, whether or not you're feeling them right away. You can start to see the changes and see the progress in your care.
Fabulous. Well, Dr. Dan Turo, as always, it's a pleasure to speak with you about, and this was a great talk about check boxes. People sometimes don't think that the chiropractic can help for all sorts of different things. In fact, my son's a baseball player, and I know a lot of parents, when the elbow and the shoulder pain, they
Good.
pop the kids with Tylenol and ibuprofen. And we have found that, just an adjustment can help.
Yeah, and that
And it.
yeah, that's a very good point. We see a lot of kids who are in sports, a lot of athletes, young and older,
Yeah,
because it's about performance. And whether
it
you're an
is.
athlete or not, our bodies are made to perform. Whether it's
Because the Tylenol and ibuprofen is just a Band-Aid, it's just masking the problem, it's not
yeah,
getting to the root of the issue.
yeah, absolutely. Well, that's a whole nother topic. It's an
We'll talk about
anti-inflammatory,
that
right?
next week.
Exactly. Yeah, it's an anti-inflammatory. So you're suppressing inflammation. Well,
Yeah,
inflammation is a natural, normal, healthy response in the body.
yeah.
So yeah, that's a whole nother topic that we
Well,
can discuss next time.
folks, we'll talk about that next week.
Exactly.
Dr. Dan Turo of Turo Family Chiropractic. It is, and when I say family chiropractic, it truly is a family chiropractic office. They're located in the North Hill section of Pittsburgh. His wife, Erin, basically is the boss, runs the show down there.
Totally.
His wonderful sister, Angela, is very knowledgeable about just a wide range of things. So it truly is a family practice, which I think just kind of really helps a lot of people knowing it's a family. So if anybody's interested in scheduling with Dr. Dan, or you're having something you're just struggling with, and maybe you just need to seek an alternative way of going at it, I highly recommend Dr. Dan Turo. We will post his website in the comments after this. But again, Dr. Dan Turo, thank you. And everybody, again, this is Tracy Armstrong of North Pittsburgh Reading Company, the key to making the first impression. Thank you so much. Thank